Hi, this is Dr. Tom McFadden of Advanced Cosmetic Surgery. We're here in Greenville, South Carolina. We do the full gamut of surgical and non-surgical cosmetic procedures here. And let's see what video topic we're going to cover today. Today's topic is going to be about breast shape. What makes a natural breast shape through cosmetic surgery? And so really the answer for me is I always try to get proportion and symmetry. Proportion, of course, is a relative term. Okay? It's about how big a breast should be relative to that patient's torso. So it's not about a number, it's not about a letter, it's not about what a particular person thinks is A cup size versus what another person thinks. It's about how does that look on that patient. And so that always has to be kept in mind because, you know, a medium C cup, I think, is perfectly proportionate. Okay? I know a lot of people have different ideas, but, you know, medium C cup for me, that's great. That is perfectly proportionate. Now, what one person thinks is a medium C is different than what another person thinks. So that's some element of variation that needs to be kind of ironed out at the initial consultation. Also, you know, what's a medium C for a person who's 5'10" is different than what's a medium C for a person who's 5'2". So that all has to be understood, and you know, you have to figure out where you are and then figure out where you want to go in order to get there, because if we don't have a common understanding of those things, then we're just not going to get the right result. So for me, it's about proportions, and that means shape, and shape is so much more important than size. So again, a lot of people have a misconception about size. Bigger is better. Bigger is not better. Okay, it's actually worse. You're going to end up paying for that over the long term. Everything sags on everybody over time, and that means everybody, and everything does sag. So more weight means more sag, and that's not great for a 10-year result. And so that's always my goal, is I want the patient to look as best as they can 10 years from now, 10 years after the operation. So proportion is really important. Symmetry is really important. Other people are concerned about scars. You know, are my scars going to be really visible? It mostly depends on how that patient heals. I prefer to use the endoscopic breast augmentation, which is an incision in the axilla, okay, in the underarm area. I think that ends up healing with more forgiveness. It's less perceptible, and I think ultimately that gives much better support to the breast because the muscle layer holds that breast or that implant up over time better over the years than an inframammary crease incision or a periareolar incision. There's some element of window shading of the muscle that migrates upward over time, which is more evident in reoperations in my experience than an axillary incision. I always want a natural look. In fact, when someone has an operation and they come back to me and they say, you know, it looks great. I told my girlfriend that I had a breast augmentation. They say, oh, you look completely natural, like you never had an operation. That's a win for me. I like the natural look. We can do whatever you want, okay? But you have to understand what you're asking for. Little bit smaller is okay. A little bit bigger than a medium C is okay. You know, I mean, quite honestly, I think anything from a B+, a true B+, to a true C+ is okay. And that is within the realm of proportion. So, but we're here to serve the patient, okay? And so I only make recommendations. The patient decides ultimately what they want, and then we go with that, and hopefully we hit the mark, and I hope that they're happy. That's always our goal, is to make the patient as happy as possible. So I hope you enjoyed this video. Be sure to like and subscribe, and watch in the future for more videos just like this.